Hey guys, Anthony Avila, Doctor of Physical Therapy, owner of Avila Physical Therapy, host of your Coastal Bend Spotlight Series. It's my absolute pleasure to introduce our guest today, a well-regarded, well-respected individual amongst the healthcare community, and someone from whom I know you'll learn a tremendous amount from today. A board-certified, fellowship-trained orthopedic specialist with a special emphasis in orthopedic pediatric surgeries, a proud father of two lovely daughters, an avid fisherman and outdoorsman who also enjoys getting on the golf course and hitting those long balls just as much as I do. Without further ado, let's give it up for Dr. Eric Waite. Dr. Waite, we talked about wanting to dive into your story. So how does a father of two outdoorsmen, golf enthusiasts with a sports background work into becoming a board certified orthopedic surgeon with a special emphasis in pediatric surgeries?
From the beginning, like from high school or from college, or what are you thinking?
Yeah, so like what initially drew you? Was there any, personal moment that guided your path or maybe a mentor that influenced that pathway for you?
Oh, sure. Okay, absolutely. Well, most orthopedic surgeons have a similar origin story where they had an injury that occurred at some point in their career where they were introduced to the field. Mine occurred when I was 14 years old. I was playing baseball on a less than manicured type field, and I had an injury where the pitcher attempted to pick off and I went to get back to first base and I banged my knee on a rock. And when I did that,
Wow.
I actually had an osteochondral injury to my patella. At that point, I didn't know. It was
Okay.
14. I knew my knee hurt and I knew I couldn't run. When I finally ended up going through the process of seeing the orthopedic surgeon, getting it fixed, getting better, and being able to continue my athletic career, I was hooked. I was like, I want to do that. I ended up having a couple of other knee surgeries in high school, so that solidified it with that sort of fact. And so that was my intent in going to college, was to get into med school. Also, I did have a big emphasis in sports. I played football, basketball, baseball. And so I was just trying to do something while I was in college, and I was fortunately, to be able to play baseball. I did try 1 year of basketball. I realized I was not the right body type for that. And then switched over to baseball. In college, my major was biology with a minor in chemistry, and that was mainly to get the prerequisites that I needed to get into medical school. I knew that you have to maintain the certain things that med school look for when you get everything I did was sort of tailored towards getting into med school. It wasn't something I happened into. So you have to maintain a high GPA. So you have to focus on that. I think mine was somewhere around the 3.8, I think is what it ended up being. And then not only that, you have to do well on the MCAT, you have to do well on your pre-web classes. So that I was better at time management then than I am now. I don't know how that is possible, but that is what happened. So yeah, once you get into medical school, then you have to reorient yourself, have a different goal. And so your new goal then is to get into orthopedic surgery, which is difficult to do. So I didn't even mention that I did my undergrad at a school in East Texas called LeTourneau University.
Wow.
It's a little small Christian engineering and aviation school. So naturally, I've studied biology there. There was like 6 graduates in the biology department. It was a very small department.
That where you played baseball there as well?
It was, yeah. We were at that point, it was a Christian college, like NCCAA. So we were in like the Christian college. They switched to D3 at some point while I was there. So that was fun getting to play against the non-Christian schools. They let us know. Yeah.
So what do we got? A pitcher, outfield? Where are you at?
I played outfield. In high school, I was a first baseman, DH type. And then I get to college and they sort of had an open tryout sort of a thing because I wasn't recruited or anything like that. And you run 60s. And so for some reason in baseball, you run a 60. I don't even know what a good time for a 60 is, to tell you the truth. And I ran the second fastest 60 on the team. They're like, all right, give him a bigger glove over there in right field. We'll see what we do. So I learned how to play outfield at that point.
So the knee surgery held up from that point?
It did. It was a microfracture style surgery, and it's done pretty well. Starting to feel it a little bit now, but
Right.
done pretty well.
Yeah, nice. That's amazing to know that the origin started from you seeing an orthopedic surgeon just like yourself to being able to carry out path into sports, and then full circle moment. Now you're probably seeing some patients that are in similar positions.
Oh yeah.
That's amazing. Have you realized, I'm sure you have, in pediatrics, not only do you give, but you probably receive a lot more from your patients from
Oh,
being
absolutely.
able to help them. Is there, a deeper meaning behind what you do beyond the medical side of things?
I mean, absolutely. Am I allowed to get religious on this?
Of course, wherever you want to go with that.
Well, it. I always come back. There's a verse in Matthew that where Jesus talks about taking care of the least of these, and whosoever you take care of the least of these is how I will take care of you. And I think of the little kids that were born with birth defects, or the kids with malformed brains, or the kids that have just terrible deformities, and being able to help them is incredibly rewarding. And also, obviously taking care of the kids that can run, jump, and play, and making sure they get
Yeah,
back in the game is also rewarding. My favorite day is when I tell kids to never see me again.
yeah,
That's my
yeah.
favorite day. Yeah.
That's awesome. That's
Yeah.
awesome. Awesome to hear. I feel like physical therapy often parallels a lot of the startup, as well as we get obviously to see some of those patients come through our building. And I feel the same way. We build such great relationships with those patients, and that's really satisfying to hear that you're able to pull some of that, because I'm sure some days are not, as well put together. Sometimes you get to work a little stressed or whatever it may be, but to be able to give back, like you mentioned, and to know in the end that you're doing things that really boil down to the core of who you are, that's an awesome thing to hear.
Absolutely.
What kind of conditions or cases do you most frequently work with? So what are some patients that, on a day-to-day basis, these are going to be the kind of conditions that I'm most likely going to see today?
Pediatric orthopedics is one of the sort of the last frontiers of total body orthopedic care, which is kind of interesting. Most of the world is heading towards super subspecialized. If you go into any adult orthopedic group, usually they'll have a joint replacement guy, a hand guy, a knee guy,
Yeah.
a hip guy, spine guy, and I get to be all of those guys. Like, I'm a
Wow.
0 to 18 guy. Yeah.
Yeah.
Yeah. And so it's interesting because I never know. Like, it could be anything. Like, today I was in clinic today, so I saw probably 4 ACLs that are going to end up needing to be reconstructed, a bunch of clavicle fractures. I see a lot of distal radius fractures. Monkey bars and trampolines, man, they keep us.
Yeah, I
But
hear you.
from all walks of life, the sports kids, I see band kids, I see dancers, I see people that are active and doing things, and some that aren't, that I try to encourage to get that way.
Okay. Yeah. Yeah. And so with that same kind of narrative, what kind of patients tend to thrive with your care? Is it patients that are more proactive? Is it patients that, maybe have a certain personality type, or is there a certain type of patient that you see that, when they come to your doors, that they're going to have a really good chance of achieving the goal that they're trying to achieve?
Sure. Yeah, that's an interesting question. Kids, I guess that gets broken down into the age brackets too. So
Yeah.
your younger kids, it's going to be whoever has a more motivated parent, which they're the ones that, because those kids have to be pushed. And the older kids, they tend to be the ones that, grit is the right word. I think grit is the right word for those particular kids, because orthopedic surgery is not for the faint of heart, whether you're on my side of it or whether you're on the patient side of it. I'm usually cutting something, turning something, drilling something. So it's going to be somewhat uncomfortable for a little bit. And you have to be comfortable in the uncomfortable in order to improve and sort of lean into it rather than shy away from it. And the kids that are able to do that do exceptionally well. But if you expect to have painless surgery and painless recovery, you're gonna have.
Yeah, yeah. No, I hear you on that. Yeah. So much of what we see on our side of things is how well do you handle, the emotional side of it. A lot of people can deal with the pain, but they can't deal with the change in lifestyle,
Oh yeah.
because there is a big change when you have an injury that requires an orthopedic surgery. So yeah, that's similar to what you mentioned there. It definitely is. And like you said, it depends on the ages, the family support, that kind of thing is very important as well.
The ACL specifically, because that's such a prolonged recovery. And a lot of the kids that we do this on are kids whose identity is wrapped up in their athletic ability. And so those are the kids that I get to because I had the injury. And, you heard my origin story earlier. I get to explain to them that like sometimes bad things happen and the things that come out of it aren't what you expect, right? If I had never got injured, would I be on this side of the operating table? No, probably not. I don't know what I would be doing. But,
Yeah.
so I try to use my own experience.
For sure. Yeah, that's awesome. Inspiring possibly some future orthopedic surgeons here. So.
Let's see. Yeah, we'll see.
And so what on that aspect, you mentioned that there's a wide spectrum of, cases that you could potentially see. If you were just talking to someone in the community, what is something that people often misunderstood about your role or your specialty?
I guess this one's kind of a silly one, and I guess it's sort of a pet peeve. But whenever somebody comes in with a broken bone of any sort and they really want me to specify, they're like, all right, doc, is this a break or a fracture? And I have no idea what the difference is between those two. so because like one of them is a colloquial word and the other one is a medical word, but they mean the same thing.
Right.
Any sort of cortical disruption or disruption in the bone whatsoever to me is a fracture or a break.
Right.
And so I don't know what that means. I don't know how to answer
Yeah.
that. But I guess that, and then another one that sort of is interesting, but it's more within the medical community, is that orthopedic surgeons get a reputation for being one-track minded, I guess is the right word to say. So one of the misconceptions about it is that orthopedics is easy, or it's for the people who are less smart, or like the jocks or whatever that got into medical school. But in the reality of it, it's actually really hard to get into. And so that if you ask any medical person who's willing to have a real conversation with you about it, we usually had better board scores than they did.
Yeah, chalk that up. That's awesome. How big does a fracture have to be a break? Like,
I don't know what that means. I wish I could. It's just, again, such a small thing, but I answer it probably 20 times a day.
I think because probably the term hairline, gets thrown in there a lot, and from a community perspective, that may be where the confusion comes from. But
right.
Yeah, I hear what you're saying there. So when we're talking about a patient perspective, and you mentioned a lot of times on the younger age groups that it has to do with the parents, the family, and social surrounding around that kid. From a parent perspective, there were a lot of times where maybe your kid goes to the playground and they fall a little harder off the monkey bars. They have an injury at a football game, but is it a bruise, or how severe is that injury? What I would ask is, what can happen when patients wait too long to seek care? Or have you found how to guide patients on how to better know when to seek that care, or anything in that nature?
Okay. Yeah. I guess like knowing your kid, if you're the parent, kind of having a good, some kids are hypochondriacs or dramatic, but even then, if it's not gone within a couple of days, or if there's something they're normally really interested in doing physically, but they don't want to do it because it's going to hurt, like for your younger kids, like your 2 to 8-year-olds, then that one, you could probably take that one more seriously. It's tough to say the answer to that one. Everything I answer is qualified now. I can't
For sure.
So if it's a growth plate injury, which how are you going to know? The sooner I can get to it, the better. Obviously, if there's a major deformity, then we're probably going to seek care right away. So like if it's a broken bone or like a knee injury where the patient can't walk, those things you're going to tend to get there a little bit quicker. But most of the time, if you're having a question about it, it's probably going to be something I'll treat non-operative anyway. So you're probably okay.
Yeah. So knowing your kid is what I'm hearing there, and maybe paying attention to patterns. Is there any change in their behavior patterns, that kind of thing? And then if you're unsure, that's what you guys are there for. Yeah, for sure.
If you come up to me in the community and you hold up an arm and you say, "Hey, does this look broken?"
Yeah,
I've seen arms that look perfectly great and they're broken underneath. So I don't know. We got to
for
get
sure.
that.
For sure. Yep. That's why you got to go through the process, get them in when you're unsure, like you mentioned, and um, know your kid and pay attention. You have that kind of parent instinct about things, and those are all good points around that for sure. All right. So from a kid's perspective, sometimes you have very motivated kids out there that are trying to do everything they can to
Mhm.
stay healthy, maybe stay active around the sport or something to that nature. What's one simple step they can take today to prioritize their health? Maybe even before they get that injury or have to call your office about a setback or an injury. Is there anything that you see on your end that
Yeah.
helps patients in that realm?
Make sure, make sure technique is good, whatever it is that you're doing, whether even if it's running, throwing, jumping, landing, technique is incredibly important. I think I'm thinking of more of like the throwers whenever it comes to this sort of stuff, whenever I'm saying that, because they're the ones that tend to come in for these repetitive injuries that are preventable anyway. When kids turn from somewhere between 10 to 14, kind of depending male, female maturity level, they need to start stretching more, and they don't because they're kids still, and so they don't
Yeah.
think about it. So I see a lot of aches and pains that come in because of lack of flexibility, particularly in your more high strung, stronger type athletes. The being nice and limber can help prevent a lot of injuries. And then the thing that has been studied a lot in injury prevention, and this is one that's going to sting a lot of people in South Texas, is being a multi-sport athlete and sort of taking time off and again, I think this is more geared towards the throwers and the baseball players because they love to play year round. They only play baseball. But being a multi-sport athlete has actually been shown for injury prevention greater than a lot of other things that are out there. Like rather than personal training, lifting weights, even being limber. And I think a lot of that is because it gives certain motions and certain muscles a break for a little while you're working other ones specifically. There's an epidemic of ulnar collateral injuries in throwers and high schoolers. This used to be an injury that you only saw in the major league, and now the number one age people getting the surgery done is somewhere around 15 to 16 years old. It's not unheard of, yeah. And so I think being a multi-sport athlete is protective of that. And
Yeah.
whether it's from being a break or just again working different muscles or just being overall more healthy in different aspects, that would be the thing that I would say.
That's really good stuff there. We do tend to probably take a little bit more advantage of our weather here year round, where maybe someone who grew up north, you can't play all of those throwing sports year round. So you do get the benefit of switching sports, but that's such a good point there, Dr. Way. And also, I wanted to go back to, you mentioned growth spurts. A lot of times kids hit those growth spurts. They're heavily involved in sports, and all of a sudden we see they're able to produce another 10 miles per hour on their throw, but they're not maybe able to show the mechanics behind that transition, or they're able to kick a lot harder, but their joints aren't able to stabilize those forces as much. So we do see a lot of what you're mentioning as well. So is that kind of what you were getting at with the different age groups? And
and particularly when I was talking about stretching, because there's certain, they call them transitional injuries that happen when kids, particularly the males, they start to get that testosterone flowing, but they still have the bony structure of a kid. Yeah, I see a lot of revulsion style injuries from that. Yeah,
for sure. That's again a great point to take home and pay attention on that. So I guess around those ages, you mentioned stretching more and then maybe considering, hey, let's try something else in the off season rather than off season baseball as well. So
they have fall ball and summer ball and second summer ball, and the leagues. A lot of leagues will have pitch counts now, which I think is great. But then they're in 3 leagues.
yeah, yeah, let's not game the system. The system's there for a reason. So yeah, for sure. And so sometimes you may see patients that are maybe taking too long to come to you. If someone's out there hesitant or unsure about reaching out, what would you want them to know in that regard?
I guess the reason behind the hesitation? Is it because you don't want to waste time? Is it because you don't want to waste money? I don't know which it is, or if you're worried about wasting my time, you absolutely will not. A lot of what I end up doing is parental and patient reassurance. So if you think something might be happening, then come see me. I can tell you if it is or if it isn't, or even I don't mind talking to you about the mechanic things. And I know my partners think the same way. It's not like everything that we have is something surgical. Like a lot of times I'm just talking to people, like when kids are growing up and maybe they're walking a little funny and they want to know, is this normal? Is this something we should watch out for? I deal with a lot of that. And so, yeah, I'm all about it.
So education is a big part of what you do on a day-to-day basis. And so I would say it's, as you mentioned, real important for the community to understand you're here, not only just to bring them into an operation, but if there's any preventative steps along the way that could be educated and avoid surgery when possible. As you mentioned, don't hesitate. Come in. Let's get that looked at. So that's awesome to hear, because a lot of times, even to come into PT, patients may say things like, I have a game this week and I don't want to, miss that. Or, maybe they're delaying coming in to see a healthcare specialist because they want to get through the end of the season,
Right.
or something like that. And so,
Yep.
so yeah.
That's the thing. If they're able to play through it, then they usually don't need to see me.
Right. Yep.
I have the opposite kids come in there too, where they have just this generalized achiness, generalized, both my knees hurt, both my ankles hurt. So I can try to help figure them out too. And those can be even more difficult to try to figure out what's going on. But usually we can kind of pinpoint something.
Yeah. So tackling that from a non-athletic perspective. So maybe something like scoliosis. I know there's a lot of preventative type screenings in school and in their primary care doctor's office and that kind of thing. And so, do you have any stories around scoliosis, or when would be the best time to come out and get that looked into?
Most typical scoliosis doesn't happen until you get to there's this term called peak height growth velocity. It's actually really hard to explain, but it's when your body is changing and growing the fastest. And that's usually when scoliosis shows up. So it's usually either the point right before puberty or around puberty where you have that massive growth spurt. Most scoliosis probably isn't even there until then, which is interesting. And so that's when you should check it, which is, interestingly enough, is a time when most times parents don't see their kids without shirts on.
Yeah. So maybe 5th or 6th for females, and then 8,
Yep.
9 for the male student, as far as grades go.
Yeah, exactly. Yeah, exactly. Around those ages. And the pediatricians do a pretty good job, because they'll do a pretty good thorough body check. And then the schools have the bend over kind of check or test. But if it's something you're worried about, then you can come in, because the early we catch that, we can actually prevent a lot of surgeries. It does end up being bracing. There are some therapy methods that have been discussed about scoliosis, which they're kind of, it ends up being a postural thing, and you learn how to hold your body a certain way that can sort of prevent it. And if you come see me, we can get into the mechanics of that. But I've seen some studies that show that particular method can work. It's difficult to implement. You have to have the right motivated kid to do it.
For sure. It's definitely very, very challenging, because you're not going to see immediate changes with that. It's a long-term thing, and it takes, like you mentioned, a lot of effort on all ends there to make those changes.
Yeah. But, if people get scared of coming to see the doctor, and they think that I'm immediately going to jump to surgery, and I try not to. Like, surgery is more of a last-ditch effort for me. I mean, if I have to, I'm going to tell you that we have to, or I'll explain why I think we have to. The best surgeons are the ones that try to fix you without getting to the table.
Is there anything else you wanted to dive further into?
So one of the things that's come up a lot recently, and it's actually a conversation that I have a lot with particularly the kids that come in with the aches and pains, and even some of the athletic kids, is almost nobody that I meet is nutritionally in a good place. And one of the conversations that I have a lot is when that comes into kids, any kids really, I mean, older teenagers, fine, like they're the ones getting their own food. But when it comes to kids, it's usually somebody is giving them the food. And generally, when you look around the room, there's a lot of people that could use nutritional changes in those rooms.
Yeah.
And so I think of it as kids do better and get better when it's a familial thing. So when you're willing to jump in and do it with them, they get better rather than going with them and sort of sitting on the sidelines while they do it. They don't get as better that way. The kids that I've had that come in with a bunch of aches and pains that end up getting better, it's because their mom goes to the gym with them, or their dad is exercising with them, or the dad does the same knee exercises that I recommended. Those are the ones that get better. And so it's the lifestyle changes sort of thing that you were talking about earlier, but kids can't do that on their own. They need a lot of external motivation. Yeah.
Man, that's such a bigger issue that, maybe is seen in other realms as well. I can think of even the teachers that my kids are at school with. Certain kids may have more of a setup to help them with their homework and that kind of thing. And so you think of their homework in this medical terms, it's always best, when you can have a support system that helps with that homework for sure, and is able to kind of invest in their medical portion of that, as well as setting up habits.
It only takes 30 days to build a habit. You only have to do it intentionally for 30 days. And then after that, it's part of you. Like if I could convince people to like just drive to the gym 30 days in a row, you don't have to do anything. Just drive to the gym and go in. And it becomes part of your routine. It becomes part of your habit. And then usually that's the hardest part, is getting there. Yeah.
Yeah, for sure. That is the hardest part for sure, is planning that out and actually doing it. And so, and habits with kids, as far as we see it, and not only in kids, but in older population as well, is when your body's trying to heal, you have to kind of set it up in a way that it's allowed to heal. And so if you're stressed out, if you're not sleeping well, if you're not eating well, your body's going to have a hard time creating that extra opportunity to heal, rather than if you were to set yourself up in a way where you're getting all the hours that you need, your stress levels are down, and your nutrition is where it needs to be. That's definitely a theme that many people can relate with, but more important, as you mentioned, when you're going through a recovery situation with. Good. Awesome points there. Anything on your mind, Dr. Wade, that you want to?
Orthopedist, all we are and is somebody that you come to see, and I have certain tools in my tool belt, and my favorite tool to use is my physical therapists. And because you guys are the rock of getting these people actually better, like I spend maybe a maximum of 10 minutes with the patient in a visit, and you're spending 2 hours with them a week, an hour at a time. So I really rely on you guys. And I want all the therapists who watch this know that I truly appreciate it and know how valuable that you guys are.
Yeah, that's amazing to hear. It's such a team situation there, and back at, you guys from your side of things, there's nothing more than someone who supports their patient and cares about their patient just as much as you portrayed today. And I really appreciate, that coming from you, Dr. Wade. Yeah. Again, thank you so much, Dr. Wade, for your expertise and willingness to contribute to our Spotlight series. Give back is one of our core values at Avila Physical Therapy, and there's no doubt that goal was accomplished today. And for everyone following along, stay tuned to find out who our next appearance will be on the Coastal Bend Spotlight series. Thank you, guys.